welcome to the SVG-TV news for Monday, March 22nd. I'm Khalil Keita with the details. Today, St. Vincent and the Grenadines reported one new COVID-19 death. The National Emergency Management Organization, NEMO, said the patient is a 25-year-old male resident of Ovia who tested positive for COVID-19 on Friday, March 19th, after presenting to the Accident and Emergency Department of the Modern Medical Diagnostic Center in Georgetown with shortness of breath and decreased appetite. NEMO said the young man was transferred to the Milton Cato Memorial Hospital and died this morning at 5:45 from COVID pneumonia. 1,700 cases of COVID-19 have been reported in St. Vincent and the Grenadines since March 2020. 1,553 cases have recovered, 167 remain active, and now 10 persons with COVID-19 have died. The public is being urged to consistently use properly fitting masks, sanitize, physically distance, and get vaccinated to reduce the spread of COVID-19 in St. Vincent and the Grenadines. The mother of the latest victim of COVID-19 is seeking answers from the authorities, who informed her today that her only son passed away at the Milton Cato Memorial Hospital. According to the grieving mother, her son, who is physically challenged, never left home, and she would like to know how and when he contracted the virus. She explained that her son was not feeling well as he had a sore on his leg, and since he had a fever, she took him to the clinic in Ovia, and he was then transferred to the Georgetown Medical Diagnostic Center.
When I come to Georgetown now, we went in, they said I can't come in. They said I must go outside. I go out, stay in the waiting room. I was in the waiting room. Somebody come and tell me get out of the waiting room. Somebody come and tell me sit back in the waiting room and go and come here. Somebody wants to get that information from me. When I did sit down, when I see the come again and say, come out from there and go outside in the yard. I get out there. Somebody else come again and say, go wrong by the next of the ambulance there and stand up until I come. When I come, when they come, they say sit down. I sit down. They come. And your son positive with COVID. I said that can't happen. I said my son don't go away. And they said nobody home, we don't go away. And that can't happen. He said how much I live in a home? I said is somebody? I said don't go away.
The grieving mother said after she was informed that her son contracted COVID-19, she asked the nurses at the medical center to be tested, since she is the one who takes care of him, but she was not given the test and had to use public transportation to get back home.
Doctor told you they're going to care now? I said yes. So I said to her, so if you have COVID, you ain't checking me? She said that no, then they can't so on. You have to go back. I said, in my community. I said, fine. So one of the other nurse called me and he said, doctor, whatever. He said, did you have anything to send? I said, yes. Well, I was just struggling to take out the things. If I go with the ambulance, I could go and give the information and then the ambulance will come. The ambulance will come back here, the ambulance is going to sanitize. I said, fine, and I just come out here. I just come out.
The upset mother said she believes her son could have been better off at home.
What they do with my son, I don't see some kind of test, I don't see nothing what's going on. And so I want to know, I give them my number in Georgetown. I want to know how my number is not in the hospital. They have to call somebody to inform them and get my number from somebody. What they do with my number, really, that was really shocking to me. But I know that better they give my son to bring home back. I wouldn't know how to take care of my son because my son can't help himself. He cannot talk, he cannot walk because of his issue at his foot. I bathe my son. I know when my son wants something to eat, I give him whatever he wants, I give it to him.
Meanwhile, some residents of Ovia are not pleased with the naming of the community in the news release issued by NEMO announcing the country's latest COVID-19 death. The residents noted that regarding some of the other COVID-19 related deaths, their communities were not identified. So why Ovia?
They never mentioned the rest people who died from COVID, which community they're from, and why they should put Ovia. Why they should put someone that died from Ovia. Some people in the village don't even know my brother. He is disabled. He cannot help himself.
I do see so that it's not fair to the community because we had it's as though I was saying to somebody it's as though we're the only place people die from COVID is Ovia because that's the only name. Well, Ovia and Overland, and they are both communities above the river. And they name them, and they have named all the other deaths. Nobody knows where they came from. Well, what I'm going to say is that, well, if they have to do that, start naming communities. When any other person dies from COVID, then should let us know where those persons are from also.
The resident said their community was discriminated against when it recorded its COVID-19 case 1 year ago, and they are fearing the same will happen with the village being named as recording the country's latest COVID-19 death. Omnibus operators are not the only ones being targeted by the new COVID-19 regulation ticketing system as part of the public health measures to stem the spread of the COVID-19 virus in SVG. This was made clear by Inspector of Police Parnell Brown, who said that regulations also target bars, rum shops, restaurants, and other places of entertainment. Nashika Davis tells us more in this report.
Inspector Parnell Brown of the Royal St. Vincent and the Grenadines Police Force said from data collected, owners of bars, restaurants, rum shops, and other places of entertainment are more in compliance with the regulation than the omnibus operators. He said since the ticketing books were printed 2 weeks ago, several persons, including bar owners and omnibus operators found in breach of the regulations, have been ticketed.
Officers have been issuing the tickets to persons who are not in compliance with the protocol established in the SRNO. Most of that is being done by the Out District Police, and I can say from the first week where some persons were caught and were given tickets, those persons have since been complying with the protocol that is established by the Ministry of Health, and we are well on our way with persons complying with the protocol that is established.
Inspector used the opportunity to remind bar owners of the regulations that they must follow, noting that failure to comply can result in tickets or a charge of $500.
In respect of the bars and places of entertainment and the restaurants, persons, the owners and operators of these bars, restaurant, places of entertainment cannot entertain more than 10 persons together at the bar or nightclub at any one time. And these persons must have on their mask. The fine for that is $500. It can go to more than $500 if you issue a ticket and you does not pay and you have to go to the court can increase that fine up to $1,000.
Inspector Brown further encouraged persons to continue to comply with the Ministry of Health COVID-19 protocols, noting that it is the only way the country can keep down the COVID-19 numbers.
I am hereby advising the general public and users of public transportation, please adhere to the protocol established by the Ministry of Health and the Minister of Health. Persons who are found not in compliance can and will be penalized by law.
Reporting for SVG-TV News, Nashika Hope.
Meanwhile, the RSVG Police Force, in collaboration with the Ministry of Health, Wellness and the Environment, will be conducting a COVID-19 vaccination clinic for staff at the police headquarters and members of the general public tomorrow. The clinic will be held in front of the Central Police Station between 9 a.m. and 4 p.m. All persons who are interested in being vaccinated against the coronavirus are invited to attend. The COVID-19 pandemic has caused 2 major disruptions to schools across the country, and Minister of Education Curtis King says during this time, students have lost significantly in terms of their education. Speaking on SVG-TV's Viewpoint program last evening, Minister King said stakeholders of education, including teachers, students, and parents, are now calling for the recommencement of face-to-face instruction. Minister King said that the Ministry of Education is hoping to reopen schools on April 12th. However, the date is still conditional, which means it can be changed at any time, noting that it is important for everything to be put in place for teachers and students to return to a safe learning environment.
Our overall concern must be one of safety, even while we take into consideration the importance of our children reducing or recovering, if you like, from the disruption in their education. And hence, that is the approach that the Ministry of Education will be taking. We have in the past engaged stakeholders, and we intend to do so once again. But certainly, as I'm indicating, we will be guided by the Ministry of Health, and their advice would be critical. I usually say also, never mind the consultations that we would have within our structure. I am always at pains to point out that the final decision would not be done at the level of the consultation.
Minister King said they are awaiting instruction from the Ministry of Health, which is responsible for the protocols for the reopening of schools, and that stakeholders are also welcome to provide the ministry with their own views on what they think is needed to strengthen the protocols.
And at the present time, the Ministry of Health is still working and updating the protocols for the opening of school, if it is to be achieved on 12th of April. So I would say the protocols are in fact being developed even as we speak. And that is why, as I'm indicating, that the schools too were asked to look at their own situation so that they could help with these things. But certainly soon the Ministry of Health will be indicating the updated protocols that would allow for the opening of school.
During the three-day professional development exercise held by the Ministry of Education last week, Principal of the Georgetown Secondary School, Ronald Clark, said they re-examined the weaknesses and strengths in which schools handled the viral illness last year and highlighted some of the ways in which the ministry can provide further support to ensure the safety of all.
In order to assist us to strengthen our own protocols. And I'm glad that Minister is here, because one of the things that we discovered, and I know that it happened, this is also the case in some other schools, the issue of security. Sometimes we see security as just to stop persons from breaking and entering. But during this COVID period, we have seen where persons would have accessed the compound. Yes, we have person at the gate, security at the gate, but in some schools we have areas or the points of entry. And because of that, persons would still access the compound without going through the screening process. And what we discovered is that it just takes one person to come through that missed the screening, and things can happen. Right. So that's one of the areas that we discovered that we have to really tighten up in, and it's one of the recommendations that we plan to send to the Ministry of Education also.
Another panelist on the program was Vanrick Williams, a teacher at the Sinclair Dakin Secondary School, who said that he has done research which shows the longer schools remain closed is the wider the inequality grows among the vulnerable.
The longer schools close, there is a gap that widens between those students who are intrinsically motivated to read, to write, to study, and those who are not intrinsically motivated.
Definitely.
Right? Research also shows that before the pandemic, disadvantaged students were 5 times more likely to drop out of school, and that was before the pandemic. Now, imagine with the pandemic, these disadvantaged students, it would have moved from 5 times more likely. So it is necessary for schools to reopen. But also, safety is a key issue. The safety of students, the safety of teachers.
New measurements of the lava dome at La Soufrière shows that its height is now at 105 meters, width at 243 meters, and length 912 meters. The measurements were released yesterday following drone surveys done on Friday. Geologist and lead scientist monitoring the volcano, Dr. Richard Robertson, told SVG-TV News today that since the last estimates done about a month ago, the height of the new lava dome has grown by 15 meters, and it also shows that the growth rate has increased.
It means that in the last month, which is from about the 12th of February, which is the last time we got volume, it's increased by a rate about 2 cubic meters per second. Its rate has changed slightly, jumped up slightly from the previous time, because 12th of February we had it at just about 1 cubic meter per second, and it just goes in line with what we've been saying, that it fluctuates around 2 cubic meters per second and goes down to about 1.5. It goes up to a little bit more than that. It goes up and down.
Dr. Robertson said that no other changes are taking place at the volcano other than the continued effusive eruption. He, however, warned persons living in the danger zones of the volcano not to become complacent.
But then also, the fact is that it just keeps on doing that. Then, people get accustomed to it, and people stop. There's a certain amount of chance for complacency to set in a sense. And then people get so accustomed to it that they forget that the eruption is happening, and they don't sort of put things in place that they should be doing now for the potential that it could cause other harm beyond what is causing up in the crater. So we need to keep our guard up and keep closely following what's happening.
The geologist said that he would like to see more drone surveys done regularly, but bad weather conditions and technical problems have been a setback. Meanwhile, he said helicopter support from the French Civil Security Agency will be in SVG to help with the monitoring for at least 2 days.
They're supposed to be arriving this afternoon, hopefully. But we'll practically be working for the whole day on Tuesday and Wednesday. We'll use them to get field teams at the top to do some, usually when you have the helicopter support, you use it for doing things closer in that are perhaps more dangerous, and therefore we have the means for getting people in and out quickly. The helicopter this time is from support of the French government. I really did not make the French Civil Security Agency is providing some support for.
President of the National Consumer Affairs Association, Junior Bacchus, has shared his concern for local consumers with the new tax measure, which will see an increase of 1% on the customs service charge. We get more in this report.
Parliament recently passed a law to move the customs service charge from 5% to 6% on all imported products to St. Vincent and the Grenadines. The monies collected from the tax will go towards payments for regional organizations that SVG has signed on to, particularly those dealing with public health and disaster management. The amount expected to be raised is upward of 8 million EC dollars. The opposition labeled it as a wicked tax, which will be added to the economic pressure already facing Vincentians due to the pandemic. In a telephone interview with SVG-TV News, President of the National Consumer Association, Junior Bacchus, said the new tax measure could not have come at a worse time, explaining that Vincentians will pay more than just a 1% increase when base prices are compounded by the 16% value-added tax, VAT.
1% is going to affect every item that comes through the customs. In fact, every imported item. If the 1% goes onto a particular item, remember behind that is the 16% VAT. There is a multiplying effect. The final cost is going to be significant. That's why the government could project that they're going to get $10+ million from this 1%. Where is the 10 million coming from? All of us, the poor consumers across the country.
Like the opposition and the Public Service Union, who said the tax measure could have been delayed until the economy gets back on sound footing, Bacchus said now is simply not the time for an increase anywhere.
I am of the view that consumers cannot afford any increase, whether it's 1%, 0.5%, consumers at this stage cannot afford any further increase in any charges that especially it is levied across the board on all items that are imported.
To fully understand how the 1% increase will reflect on the Vincentian shopper's receipt, SVG-TV News visited several businesses in and around Kingstown to discuss how their prices will be affected. While the businesses we visited declined to comment on camera, the consensus was the same. The dollar-for-dollar increase will be slight, therefore the impact will be felt mainly by those who are already pinching their pockets. In response to this, Bacchus said businesses can afford to deem the increase slight because they are simply not in the poor consumer's shoes.
Every dollar more you're going to pay is a dollar short from something else that you are required to meet. So business owners will give you the impression you're not going to see it, because the point is we are seeing the business owners increase in prices every day in, day out. A lot of the items we see in the price going on is essential items. So people just buy and hope that they make ends meet at the end of the month. But more and more people are falling through the cracks.
According to the United Nations Office for the Coordination of Humanitarian Affairs, the COVID-19 pandemic is set to exacerbate the rate of severe poverty on island from 2.9% before the pandemic to 11.9% with COVID-19. In presenting the bill in Parliament last Tuesday, Minister of Finance Camilo Gonsalves defended the 1% increase on the customs service charge.
5% customs service charge versus 6% customs service charge on a case of leg and tie. When it's all said and done, fee by fee by fee by fee, you come out with $101.81 for your case if it's at 5%, and $102.76 if it's 6%.
While it is true that the government must meet its obligations to various organizations across the region, many Vincentians have had their incomes significantly reduced or have lost their livelihoods completely due to the pandemic. The question of whether an already struggling populace can afford even the slightest increase continues to ring clear in the air. Reporting for SVG-TV News, I am Shafshi Speedwell Callum.
The first phase of the Intelligent Bus Management and Monitoring System in St. Vincent and the Grenadines is moving apace with solar-powered bus stops installed across mainland St. Vincent. Larissa Pugsley-Kidd tells us more in this report.
The Intelligent Bus Management and Monitoring System is part of efforts by the government to improve the efficiency of public transport here in SVG. The ongoing thrust is to improve the efficiency of public transport in St. Vincent and the Grenadines is continuing with the rollout of the Intelligent Bus Management and Monitoring System. The installation of 40 solar-powered bus stops on mainland St. Vincent has also been completed, with devices now being placed in omnibuses, public and private. Testing of the bus stands are in progress. In Kingstown, there are 10 electronic bus stands, including at the Leeward and Windward bus terminals. Project manager David Fu and the ICT team were at the bus stop outside the Peace Memorial Hall today, where Fu explained how the instruments can be used, noting that commuters can either use an app, website, or simply check the screen for the bus arrivals.
So here, very simple to tell you. Here can tell you when the next bus arrives at the Peace Memorial Hall, this station. It's very easy. So next time you can come here, just watch. Okay, probably come to here. So 10 minutes, you can go anywhere to do anything. And then in here, in the future, we will show the bus's name. If this bus's name is Joey, we will show the Joey next 10 minutes arrive.
To date, 10 tracking devices have been installed in buses participating in the project, and the ICT team is hoping that more operators would come on board to have the tracking devices installed in their bus. An installation drive will be held at the National Public Library this Saturday.
I'm reaching out for the private ones who want to install. They can come this Saturday. We are going to be installing at the National Public Library from 2 o'clock. And if they don't want to install, but they want a bit more explanation of how this system is going to work, we'd have persons there who would be able to explain to them as well.
With fears that the movement of vans will be monitored by the authorities, project coordinator Desiree Armstrong said that this is not the case.
Because if we think about it carefully, if I am a commuter and I know exactly when my bus will arrive somewhere, I would feel comfortable taking that bus all the time. So the bus owners now will develop more passengers gravitating towards their buses. So everybody stands to benefit, in my view.
Upon completion, SVG will be the first country in CARICOM to have the e-bus system operational.
Of course, in Caribbean region, this is the first one. So we feel so honored to have this chance in St. Vincent to implement this project.
For SVG-TV News, Larissa Pugsley-Kidd.
SVG Today joins the rest of the world to observe Water Day with the focus on the value of water. In his message to mark the occasion, Minister of Health, Wellness and the Environment, Sinclair Prince, says that SVG has its own challenges, including water conservation, and asked that Vincentians do their part in conserving water.
Washing hands was one of the cheapest, easiest, and most effective ways to prevent the spread of this disease. Water use touches every facet of life. It goes without saying that no one can be without water, and certainly during this trying period in our Vincentian history, as we battle COVID-19, dengue, and an effusive eruption of the La Soufrière volcano, we are even more challenged to take issues of water value seriously. Conservation of this precious resource is therefore important and necessary. I invite us all to join hands with the CWSA and have adequate water storage capacity at home and in your place of business. Though we pray and hope for a resolution to the many challenges mentioned above, it is still the responsibility of the home and business owner always to be prepared with adequate water storage capacity.
Minister Prince said that government is doing its best to ensure that citizens have no shortage of water, noting the moratorium currently in place by the Central Water and Sewerage Authority, the CWSA.
We'll see the discontinuance of water disconnection and a further ease of 10% if domestic customers zero their water bill balances, and 5% if you halve your bill balances. This very important move comes on the heel of a similar move in December that saw benefits of up to 15% to domestic customers who zeroed their bill balances. Furthermore, as the nation continues to deal with dengue fever through its eradication program, we must note that risk factors for the upsurge in cases can be linked to a variation in rainfall and temperature, which is likely caused by climate change.
President of the Garifuna Heritage Foundation, David Darkey Williams, says even though the 8th International Garifuna Conference was held virtually this year because of the COVID-19 pandemic, it was a success. Williams told SVG-TV News that they were able to deliberate on a number of issues, including reparations and, more particularly, making Baliso a sacred place.
Suggestions about approaches that could be taken in securing Baliso. And those coming out of the conference, those are things we have to work with or work on and see how best we could maneuver our way through the legalities and so on. That is going to take a very long time. It can't be done next year, it can't be done in 3 years, but we could find a framework.
The cultural ambassador said that he was pleased with the local students who made the contributions to the discussion on Baliso and continues to encourage Vincentians to take pride in their heritage and culture.
We would like to see more evidence of appreciation of the heritage and culture. I know it. I hear it coming from artists and other persons that there is a dearth of appreciation among the general public for some of the work that they put out.
Williams said that the foundation will continue to do its part to ensure that the struggles and triumphs of our ancestors, the Garifunas, are not only celebrated in March, Heroes and Heritage Month, but all year round.
It's not just in that kind of history and other aspects of our traditions. It is also for the modern artist, for example. We need to embrace those things that are ours, just that little bit more, so that we offer more encouragement and more tangible returns to the people who put out the efforts.